Hello and welcome. Today we'll be discussing a relatively rare but important topic: transitional cell carcinoma of the urethra. This video aims to provide a comprehensive overview of this disease, covering its causes, symptom diagnosis, treatment, and more. Our goal is to equip you with a better understanding of this condition. The exact cause of transitional cell carcinoma of the urethra isn't fully understood, but several risk factors have been identified. Smoking is a major culprit, as the carcinogens in tobacco smoke can damage the lining of the urinary tract. Exposure to certain chemicals, particularly those used in the dye, rubber, and leather industries, has also been linked to increased risk. Chronic inflammation or irritation of the urethra, perhaps due to recurrent urinary tract infections, long-term catheter use, or urethral strictures, can also contribute. Finally, prior history of bladder cancer is a significant risk factor, as the cells involved are similar and the disease can spread or recur in other parts of the urinary tract. Transitional cell carcinoma, also known as urothelial carcinoma, arises from the transitional cells that line the urethra and other parts of the urinary tract. When these cells undergo genetic mutations, they can begin to grow uncontrollably, forming a tumor. The tumor can then invade the surrounding tissues, including the urethral wall and potentially nearby organs like the bladder or prostate. As the tumor grows, it can obstruct the flow of urine, causing various symptoms and complications. In more advanced cases, the cancer cells can spread or metastasize to distant sites in the body through the lymphatic system or bloodstream. Transitional cell carcinoma of the urethra is considered a rare cancer. It accounts for a small percentage of all urinary tract cancers. It's more common in men than women and typically diagnosed in older adults, usually between the ages of 60 and 80. The incidence rates can vary geographically, potentially due to differences in environmental exposures, smoking habits, or access to healthcare. The symptoms of urethral transitional cell carcinoma can be varied and sometimes subtle, making early detection challenging. The most common symptom is hematuria, or blood in the urine. This can be visible to the naked eye, or only detectable under a microscope. Other possible symptoms include dysuria, which is painful or difficult urination, urinary frequency or urgency, feeling the need to urinate more often or more urgently than usual, decreased urinary stream, a weaker flow of urine, and in some cases, a palpable mass or lump in the groin or perineum. In advanced stages, symptoms may include pelvic pain, bone pain, or swelling in the legs. Diagnosing transitional cell carcinoma of the urethra typically involves a combination of tests. A physical exam and review of medical history are the first steps. Urine tests, including urinalysis and urine cytology, can detect blood or abnormal cells in the urine. Cystothroscopy, a procedure where a thin, flexible tube with a camera is inserted into the urethra, allows the doctor to directly visualize the urethra and bladder lining. If any suspicious areas are seen, a biopsy or tissue sample is taken and examined under a microscope to confirm the presence of cancer cells. Imaging tests such as CT scans, MRI, or ultrasounds can help determine the extent of the tumor and whether it has spread to other parts of the body. While various staging systems exist, urethral cancers can be classified based on their location within the urethra, anterior or posterior, and by their grade and stage. Grade refers to how abnormal the cancer cells appear under a microscope, with higher grade tumors being more aggressive. Stage describes the extent of the cancer, including the size of the tumor, whether it has spread to nearby lymph nodes, and whether it has metastasized to distant sites. The most common staging system uses the TM classification system, where T stands for tumor size, N for lymph node involvement, and M for metastasis. Treatment for transitional cell carcinoma of the urethra depends on the stage and grade of the cancer, as well as the patient's overall health. Surgery is often the primary treatment option for localized tumors. This may involve partial or complete removal of the urethra, along with surrounding tissues. In some cases, reconstructive surgery may be necessary to restore urinary function. Radiation therapy, using high-energy rays to kill cancer cells, can be used as a primary treatment or after surgery to eliminate any remaining cancer cells. Chemotherapy, using drugs to kill cancer cells throughout the body, may be used for advanced or metastatic disease. In some cases, a combination of surgery, radiation, and chemotherapy may be recommended. Newer therapies, such as immunotherapy, are also being investigated for their potential role in treating urethral cancer. While it's impossible to eliminate the risk entirely, there are steps you can take to reduce your chances of developing transitional cell carcinoma of the urethra. The most important is to avoid smoking and exposure to known carcinogens. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, may also help. If you have a history of bladder cancer or other urinary tract issues, regular check-ups with your doctor are essential for early detection and management. The prognosis for transitional cell carcinoma of the urethra varies depending on several factors, including the stage and grade of the cancer, the patient's age and overall health, and the response to treatment. Early detection and treatment offer the best chance for a positive outcome. However, even with treatment, recurrence is possible, so ongoing monitoring is crucial. Recent research is focused on developing new and more effective therapies, including targeted therapies and immunotherapies, to improve outcomes for patients with this challenging disease. Scientists are also working to identify new biomarkers that can help predict prognosis and guide treatment decisions.